I would like to address concerns that were raised this weekend in a number of news stories about the procedural masks that have been distributed throughout the province. Some have claimed that we have sent domestically sourced procedural masks to other provinces and have distributed masks sourced from China to our frontline workers. Now, I want to be clear, this is untrue. All procedural masks which have been sent to other provinces were sourced from manufacturers in China. Those same masks are also being used here in Alberta. To be clear, as JP from AHS will soon elaborate, the masks sourced from China are safe for use in Alberta and all other provinces. All of our PPE meets the required safety standards, and all products are tested prior to being ordered and then are inspected again before they are supplied by AHS to our sites.
Would like to say that at this point in time, and we continue to have an adequate supply of PPE within Alberta, and we're very comfortable with the stock levels we have and the orders that we are placing on an ongoing basis to be able to receive these PPE into our system. And pleased to say that we have anywhere from 30 to 60 days of PPE on hand at any given time as we look at all of our inbound supplies. Now, this weekend we did hear concerns about some of the procedural masks, as alluded to earlier. And these were masks that were brought in from two different manufacturers. And we've heard from our frontline teams that they're concerned about the fit, and in particular that these nose pieces for one of the brands is uncomfortable and doesn't fit like it should. We understand that our frontline staff like familiarity and they like the products that they have been used to using within our system. And I'd like to state that the masks that you're used to using has been around in our system for more than 20 plus years. And so there's a certain level of comfort with these masks. When we say that the mask meets standards, they meet all of the clinical requirements for the use of these masks in a healthcare setting. When I alluded to some of the comfort challenges such as not sitting well on the nose and a sizing issue of it slipping, I think that those are things that we are working on with the manufacturer to try and resolve those issues. The issue related to the odor, I'm glad that you asked that question, so it gives me an opportunity to actually address that. So when these masks are manufactured and they come off the production cycle, they're actually quite hot. And in terms of from trying to prevent contamination of these masks, they're immediately put in plastic packaging. And what that does is it actually seals the heat and the smell of the masks within that packaging. What we are doing to address that issue is we've had staff over the last many days that have actually taken out the masks from those plastic wrapping, and they have put these masks in boxes so that they can get aired out. We've heard concerns around people that say that there is irritation or a skin rash. As I alluded to earlier, we are certainly wanting to work with those folks, and there are other options available within our system that if there is some sort of a reaction, then they can certainly access some of the other masks that are available in the system that they may be used to.